Today, I'm here to discuss with you EMR and the benefits it will bring to our patients. So, what exactly is an EMR? An EMR is an electronic medical record. You may have heard it called an electronic chart, but it is much more than that. With the old paper chart system, in order to review prior records, those physical charts were requested and pulled from the medical records department and then set aside for later viewing. EMRs allow medical professionals to access previous records just by selecting the visit from their computer or mobile device. Patients are also able to engage more fully in their own care through our patient portal. We implement safeguards to ensure optimum security of your information. There will be some positive changes throughout your stay that you should notice. EMRs are designed to optimize the patient's experience. You will likely see staff utilizing secured mobile devices for various tasks such as tablets or computer on wheels, COWs. Your armband will now have a photograph and barcode label for your safety. One of the biggest changes that is not exclusive to our facility campus are the changes to your own home. You will be able to view copays, deductibles, and estimated charges all before you arrive. This gives you a greater understanding of what to expect. Pre-registration for testing and procedures may also be done via the patient portal. We will go over patient portals more in depth later in the presentation. Once you arrive to registration, insurance verification is done instantly. In some instances, the registration clerk may be utilizing a mobile device equipped with a mobile card reader to take your payment and automatically email you a receipt. This alleviates the need to wait on multiple departments to review your information once you're on site. You can just breeze through and be on your way to why you were here in the first place. The registrar will take a photo that will be placed on your armband. This is to protect our patients from others attempting to defraud or steal their identity. You will also receive a pamphlet about your rights to privacy. One of the changes we're most proud of with the introduction of our EMR is how our patients will receive a more intimate clinical experience. Because each of our patient rooms is equipped with a computer connected to the EMR, our clinical staff is able to document everything directly at bedside in the patient's presence. This not only allows increased interaction, it ensures the most accurate information is gathered because it is entered directly at the point of contact. When a paper chart system is used, the clinician would have to go back to the desk after doing their original assessment and hope they aren't pulled away before they can document the information without forgetting. Having the electronic record at bedside also allows you to ask questions and get immediate answers. Our facility tries exhaustively to be your home for healing and wellness. EMRs aid us in that effort. One example of this is through medication therapy. When medications are ordered and administered, they're automatically checked for interactions against your known allergies and other medications you are prescribed. The barcode on your armband we mentioned earlier is scanned to ensure you are the correct recipient of that medication and that the correct dosage is administered. Another example deals with clarity. We have all heard the old adage about a physician's handwriting. With our computerized physician order entry system, CPOE, practitioners are able to enter orders directly into the electronic record themselves. This does away with all the issues dealing with poor handwriting, ambiguity, and semantic interpretation of the order. With all of your information now in one location, you may be curious about its security. We have many safeguards in place to protect your PHI. First, let's go over what PHI is. The United States Department of Health and Human Services defines PHI as any individually identifiable health information. This ranges from information about your name, social security number, date of birth, or any treatment you may receive. Authorized users are only given access to the PHI that is necessary to adequately do their job. Because patient safety and quality of care are paramount in concern, extensive, continual training is provided to all staff who utilize our EMR. Additionally, if we believe there may have been a breach, our compliance department is able to audit all of the access. Our EMR will also be linked to an HIE, a Health Information Exchange. This allows patients and healthcare providers necessary access to share data securely. A good example of this would be pertinent medical information made available if you were treated urgently at another facility. If, heaven forbid, you were in an accident and you received treatment in another facility, they would be able to access your health records if they were linked in to our HIE. This improves the quality of care you would receive through continuity of care. Once you are discharged, an individualized set of instructions will be generated by the EMR and reviewed with you at bedside. If your condition warrants, supplemental materials such as therapy exercises will be reviewed and made available for your independent view through the patient portal. Discharge is also where the patient portal access will be explained. Patient portal is the ultimate means of patient engagement. You will have access to your results and records, treatment tools for chronic illness, reference material, and insurance documents. You will also be able to make follow-up appointments, pre-register for tests and procedures, and most importantly, ask questions. We are proud that the improvements we are making to our facility will have such a tremendous impact on our patients. The introduction of our EMR allows us to more safely administer care to our patients, all the while encouraging them to be more engaged in their own care. With your involvement and technology, we plan to change the face of wellness in our community.